is on her way, sir. That's what I was told.
Okay. Good morning, everybody. I'd like to call this meeting of the House Health Committee to order. Devin, will you please take the roll?
Chair Frankel.
Here.
Representative Benham. Borowski.
Designation.
Boyd. Hanbidge.
Designation.
Howard.
Designation.
Khan. Kozarowski. Krajewski.
Designate. Oh, there he is. Okay.
Mays.
I saw her.
Freelaughton. Sanchez. Schusterman.
Designation.
Venkat.
Designation.
Chair Rapp.
Here.
Representative Bonner. Borowitz.
Designation?
Brown.
Designation?
Day.
Designation?
Krupa.
Here.
Roy.
Here.
Rossi.
Designation?
Stair.
Designation. And she is on her way.
Twardzik.
Here.
Walsh. Zimmerman. We have a quorum.
Thank you. Chair calls up House Bill 1851, printers number 2297, sponsored by Representative Curry. Erica, would you please explain the bill?
House Bill 1851 permits certified nurse midwives to certify fetal death alongside existing professionals.
The question is, will the committee report House Bill 1851? I'm offering Amendment A02201 to create uniformity within the language of the Vital Statistics Act and to allow certified midwives licensed by the board to declare fetal death. Will the committee agree to the amendment? Are there comments on the amendment?
Yes.
Chair Rapp?
I'm just commenting, sir, that I will be supporting the amendment.
Thank you, Chair Rapp. Are there any negative votes on the amendment? Seeing none, Amendment A02201 is adopted. The vote on House Bill 1851 is amended. The question recurs. Will the committee report House Bill 1851 as amended? Is there any discussion on the bill? On that question, the chair recognizes Representative Mays, who is speaking on behalf of Representative Curry, who could not be with us today.
Thank you, Chair Frankel and Chair Rapp, and to members of this committee for the opportunity to offer remarks on House Bill 1851, legislation designed to strengthen maternal health care in Pennsylvania by recognizing and empowering the essential work of our nurse midwives. Every year, midwives provide compassionate, competent care to thousands of women and infants from prenatal visits to labor and delivery and throughout the postpartum period. They deliver safe, high-quality medical care and play an essential role in supporting healthy pregnancies and healthy families. Yet, despite their extensive training and trusted presence in communities all across this Commonwealth, nurse midwives remain limited by gaps in state law that restrict their ability to fully serve their patients. House Bill 1851 addresses one of these gaps by updating the vital statistics law to allow nurse midwives to complete fetal death reports. When a nurse midwife is the primary birth attendant for childbirth, whether in a hospital, at home, or in a birthing center, they are already the clinician most familiar with the circumstances of that labor and delivery. Allowing them to sign the fetal death certificate simply aligns the law with their professional role. This change will streamline reporting, reduce unnecessary delays, and ensure that families experiencing profound loss are not burdened with additional procedural hurdles. In settings where a physician may not be present, this authority is even more critical to providing compassionate and timely care. I respectfully ask the members of this committee to support House Bill 1851 and for your partnership in strengthening maternal health across Pennsylvania Empowering midwives means expanding access, improving maternal health outcomes, and ensuring that families receive the comprehensive care they deserve. Thank you so much. I appreciate an affirmative vote.
Thank you, Representative Mays. Are there other comments on the bill? Chair Rapp?
Thank you, Mr. Chairman. Mr. Chairman, I will be supporting this bill. I appreciate the comments that we're going to be supporting maternal health. Thank you, Mr. Chair.
Thank you, Chair Rapp. Midwives play a crucial role during pregnancy and childbirth. During a tragic incident that might result in a fetal death, they should be able to also certify that death. Those in favor of reporting House Bill 1851 as amended will vote aye. Those opposed will vote no. Are there any negative votes on House Bill 1851? Seeing none, House Bill 1851 is reported unanimously from the House Health Committee. Thank you, members. The chair calls up House Bill 1202, printers number 1350, sponsored by Representative Zimmerman. Mike, would you like to please explain the bill?
Absolutely. Thank you, Mr. Chairman. House Bill 1202, introduced by Representative Zimmerman, would task the Commonwealth with creating and maintaining a PPE stockpile and also create a infectious disease advisory commission to oversee and make recommendations for long-term care facilities. Thank you, Mr. Chairman.
Thank you. The question is, will the committee report House Bill 1202? On that question, Representative Zimmerman offers Amendment A02202. Mike, would you please describe the amendment?
Thank you, Mr. Chairman. Amendment A02202, offered by Representative Zimmerman, would remove the requirement that the Commonwealth create and maintain a PPE stockpile. There will be a newly created Infectious Disease Advisory Commission that will issue a report within 24 months on several issues, including the feasibility of a stockpile, recommendations for legislative or regulatory changes needed regarding a health-related disaster emergency, coordination with counties, other state agencies, and steps to ensure the health and safety of individuals within facilities during a disaster emergency. The report may be updated as needed, but at least once every 7 years. The commission will be comprised of both legislative and gubernatorial appointments as well as stakeholder experts. For the knowledge of the committee, this amendment was drafted among the two chairs' offices as well as the prime sponsor and the department. Thank you, Mr. Chairman.
Thanks, Mike. Will the committee agree to the amendment? On that question, I recognize Representative Zimmerman.
Thank you, Mr. Chairman. I'll be brief, as staff has already provided a summary of the amendment I'm offering today. This amendment is a result of several months of negotiations among Chair Frankel's and Chair Rapp's offices, the Department of Health, and myself. It focuses the bill on a core aspect that I feel was lacking during the pandemic: proactive planning by the Commonwealth for long-term care facilities during a pandemic. However, it also provides for this newly created Infectious Disease Advisory Commission to investigate and evaluate and the possibility of maintaining a PPE stockpile for the Commonwealth, which is the part of my original bill that is being revised. I will have more to say on the bill after it's amended. However, I do want to thank Chairman Frankel, Chairwoman Rapp, staff, and the Department of Health for working on this amendment to get it to this point where this bill can be considered in committee today. I'm asking for my fellow committee members to support the amendment. Thank you, Mr. Chairman.
Thank you. Are there other comments on the amendment? Chair Rapp?
Thank you, Mr. Chairman. I definitely am supporting the amendment, but I'll save my comments for final passage.
Good. Thank you. I'm grateful to Representative Zimmerman for offering this amendment, which is the product, as noted, of many conversations. Is there any opposition to Amendment A02202? Seeing none, Amendment A02202 is adopted. The question recurs, will the committee report House Bill 1202 as amended? Is there discussion on the bill before I turn to the chair? Representative Zimmerman.
Yes, thank you, Mr. Chairman, for bringing this bill up for consideration today. I'm confident in saying that No one here is hoping for another pandemic, but as legislators, we must always be cognizant and recognize that one could happen at any time. The better we prepare, the more we collaborate, and the more proactive we are, the better the Commonwealth will be. I'm not going to revisit all the difficulties that we encountered during the pandemic. As legislators, each of us can recount some of the frustrations and experience we experienced in trying to help our constituents. One issue that repeatedly came up for me was the inconsistent information that I was receiving to keep local officials, facilities, and constituents up to date on what was transpiring. This frustration is not meant to cast blame on anyone. The pandemic was a difficult time for all of us as legislators. However, it became apparent to me that we needed the proverbial seat at the table when discussing how best to assist long-term care facilities through another pandemic if one should occur in the future. This newly created Infectious Disease Advisory Commission will be responsible for examining and analyzing the practices, processes, and procedures related to prevention of and the response to infectious diseases in facilities. A bipartisan group of legislators will serve on the commission along with representatives of applicable state agencies and relevant stakeholders, groups, and experts. The commission will issue a report within 24 months and update the report as needed, but at least once every 7 years. By being proactive, we can better prepare for the next pandemic. While I'm hopeful that one never comes, we must be prepared in case it does. I'm asking my fellow committee members to support this bill in committee today. Again, I want to thank Chairman Frankel, Chairwoman Rapp, and staff for their work on getting this before the committee today. Thank you, Mr. Chairman.
Other comments on the bill? Representative Kahn?
Thank you, chairs, and thank you, Representative Zimmerman, for working on this bill. I am one of those nurses that was feeling the effects of lack of PPE, having to use my nursing masks, my PPE, my protection equipment, as did countless other nurses across the Commonwealth, and as individuals did as well. Truth is, we were not prepared for the last pandemic on a federal level. We certainly were not prepared, and also on the statewide level either. I'm hopeful that a bill like this is going to help us be more prepared so that we can protect the patients that are in our healthcare facilities, protect our healthcare providers, and protect the public. And I think one of the failures of the last pandemic was having nurses at the table where these decisions were being made, that there were not enough nurses that were able to give input at the highest levels. And I'm hopeful that this commission is also a venue that we can get nursing input to make sure that we have nurses at the table. So thank you very much, Representative Zimmerman. This is a great bill, and I appreciate the bipartisan work to get this to the General Assembly's to the floor. Thank you.
Thanks, Representative Kahn. Chair Rapp? Is there somebody else?
Thank you, Mr. Chairman. Oh, I'm sorry.
No, go ahead.
Please. And I'd like to thank Representative Zimmerman as well for bringing this bill forward. And prior to the pandemic, as has been said, it was difficult for many of us to envision that a global pandemic could occur in this day and age. To say that the world was unprepared for the COVID pandemic is definitely an understatement. As legislators, we learned a lot both during and after the pandemic. Issues regarding long-term care facilities reached such a crisis point that I introduced legislation at the time that became Act 67 of 2021 to ensure that essential caregivers were named for each resident of a congregate care facility. While we may disagree on the proper steps that should have been taken during the pandemic, I think we can all at least agree that we need to be better prepared if another pandemic occurs. We need to be proactive instead of reactive. One of the steps that we need to take is to ensure that we properly plan for how long-term care facilities and their residents will be treated. In addition, we need to ensure that legislators have a seat at that table. I want to commend Representative Zimmerman for his work on this bill, for his willingness to work across the aisle and with the Department of Health to amend this bill to get it to a place where it can be considered in committee today. And I want to thank you, Chairman Frankel, for your willingness to run this bill in committee today. I will be supporting the bill and urge my committee members to do the same. Thank you, Mr. Chairman.
Thanks, Chair Rapp. This is a bill that looks towards the future, creating the space for planning in advance of a disaster emergency. Be prepared is not just a Scouts motto. I thank Representative Zimmerman and the Republican staff and Chair Rapp for their thoughtfulness in preparation of this language. Those in favor of reporting House Bill HB 1202 as amended will vote aye. Those opposed will vote no. Are there any no votes on our committee? See none. House Bill 1202 is reported as amended unanimously. Thank you, members. The chair calls up House Resolution 379, printers number 2695, sponsored by Representative Curry, declaring January 23rd, 2026 as Maternal Health Awareness Day. Those in favor of adopting the resolution will vote aye. Those opposed, no. Is there opposition to the amendment? There's opposition? No, Devin, are there any comments? Before? Okay.
Well, okay, go ahead.
All right. Representative Mays?
Thank you, Chairman. House Resolution 379 designates January 23rd, 2026 as Maternal Health Awareness Day in Pennsylvania, and this recognition is not symbolic. It is necessary, urgent, and long overdue. Maternal health in this Commonwealth and in this nation is in crisis. Despite advances in medicine and improvements in how we deliver care, far too many women continue to face preventable complications during pregnancy and childbirth. Far too many families experience tragedies that should never happen in a modern healthcare system. The CDC defines a pregnancy-related death as a death of a woman during pregnancy or within 1 year of the end of pregnancy from causes related to or worsened by pregnancy. The data tells a devastating story. In 2021, the U.S. maternal mortality rate climbed to 32.9 deaths per 100,000 live births, a steady and alarming rise. Here in Pennsylvania, the picture is even more stark. Our pregnancy-associated mortality rate reached 97 deaths per 100,000 live births in 2021. These are not just numbers. These are mothers who should still be with their families. These are infants who will grow up without knowing the women who brought them into this world. House Resolution 379 is a call to action. It shines a light on the crisis, on the disparities, on the preventable causes of maternal deaths. By recognizing Maternal Health Awareness Day, we affirm that this issue demands attention, investment, and a statewide commitment to change. I respectfully ask my colleagues for support of House Resolution 379. Let us stand together to protect the health, safety, and dignity of mothers and families all across Pennsylvania. Thank you.
Thanks, Representative Mays. Other comments? Chair Rapp?
No, Chairman Frankel, I would have some comments, but I am going to refrain from giving my comments in light of bills that we will be voting on the floor today.
Thank you. Devin, will you please take the roll?
Chair Frankel.
Aye.
Representative Benham. Yes. Borowski.
Designation yes.
Boyd. Yes. Hambidge. Yes. Howard.
Designation yes.
Khan. Yes. Kozarowski. Krajewski. Yes. Mays. Yes. Freelaton. Yes. Sanchez. Yes. Schusterman.
Designation yes.
Venkat.
Designation yes.
Chair Rapp.
Yes.
Representative Bonner. Yes. Borowitz.
Designation yes.
Brown.
Designation yes.
Day.
Designation yes.
Krupa. Yes. Roy.
Yes.
Rossi.
Designation yes.
Stair.
Yes.
Twardzik.
Yes.
Walsh.
Yes.
Zimmerman.
Yes.
26-0.
Thanks.
Passes.
Thank you, members. House Resolution 379 is reported unanimously from the House Health Committee. Finally, the chair calls up House Resolution 382, printers number 2702, calling on Congress to extend the expanded premium tax credits. I will recognize the prime sponsor, Representative Bellman.
Thank you, chairs, and thank you to my colleagues. If Congress fails to act by the end of this year, hundreds of thousands of Pennsylvanians who buy health insurance through Penny will face massive premium increases or lose financial assistance entirely. This is an urgent issue that is before us today. Penny is our state-based health insurance marketplace, and it is working. During open enrollment for 2025, nearly 500,000 Pennsylvanians enrolled, the highest number in Penny's history. Roughly 4 out of 5 enrollees receive financial assistance, showing that affordability is a key driver of coverage. When insurance is affordable, people get covered. When it isn't, they drop out of coverage and delay care. The Affordable Care Act originally provided premium tax credits, but those credits came with a harsh limitation, the subsidy cliff, which cut off assistance for anyone earning above 400% of the federal poverty level. That left many working families, particularly older adults and self-employed Pennsylvanians, paying a significant portion of their income just to keep coverage. Congress addressed this issue through the American Rescue Plan and the Inflation Reduction Act by expanding premium tax credits and eliminating the cliff. These expanded credits allowed hundreds of thousands of Pennsylvanians to maintain coverage and access critical care. But these credits are set to expire on December 31st, 2025. If Congress does nothing, premiums for Penny customers will, on average, double. That means real people, seniors, small business owners, and working families will be forced to choose between health care and basic necessities like housing, food, and utilities. And this is not theoretical. Penny's own data already shows that older Pennsylvanians are dropping out of coverage because they simply cannot afford it. State estimates indicate that up to 150,000 Pennsylvanians could lose coverage entirely, and the total loss in premium tax credits in Pennsylvania could exceed $1.25 billion annually. When coverage becomes unaffordable, people delay care, they rely more heavily on emergency rooms, and increase uncompensated care across the health system. Only Congress can fix this. This is why this resolution matters. It sends a clear message that Pennsylvania will not stand by while health care becomes unaffordable for nearly 500,000 residents. I strongly encourage my colleagues to support this resolution. Thank you.
Thank you, Representative Bellman. Are there other comments on the resolution? Chair Rapp.
Mr. Chairman, thank you. I am going to be voting no on this resolution. I think we all know and understand that there are ongoing negotiations in Congress regarding insurance, and I at this time am not in favor of sending a letter to our delegation when everything is still in negotiation. But I appreciate you bringing the resolution forth. But I am asking my members to vote no, and I will be in opposition as well. Thank you, Mr. Chair.
Thank you, Chair Rapp. I should note that based on the most recent news, the Speaker of the House, Mike Johnson, is refusing to bring the bill up for a vote, and even in the face, I think, of bipartisan support for moving forward on this. So I think it's very timely. You know, health insurance offers people the opportunity to get health care services, but it also offers them peace of mind. When people can afford health insurance, they get it. We know that because of the extra 150,000 Pennsylvanians who signed up for health insurance when the subsidies put insurance within reach. The loss of affordable health insurance means more uninsured, certainly, but it also will likely mean more people stretching their dollars and purchasing skimpier plans with high deductibles. That translates into more medical debt, but it also means more hospitals providing uncompensated care. For those hospitals that struggle, This is one more burden on a very slim operating margin. We know that people who can afford insurance will show themselves responsible. Why are we taking away the benefits that make that possible? I urge a yes vote on this resolution, and those in favor of adopting the resolution will vote aye. Those opposed, no. Devin, will you please take the roll?
Chair Frankel.
Aye.
Representative Benham. Borowski.
Designation yes.
Boyd.
Yes.
Hanbidge. Howard.
Designation yes.
Khan.
Yes.
Kozarowski. Grajewski.
Desi-
Mays.
Yes.
Friolatin. Sanchez. Schusterman.
Designation yes.
Venkat.
Designation yes.
Chair Rapp.
No.
Representative Bonner. No. Orowitz.
Designation no.
Brown.
Designation no.
Day.
Designation no.
Krupa. No. Roy. No. Rossi.
Designation no.
Stair.
No.
Twardzik.
No.
Walsh. No. Zimmerman. No. Ayes are 14, the nays are 12. Resolution passes.
Thank you, members. Resolution 382 is reported affirmatively from the House Health Committee. Seeing no further business, I still want to wish everybody a happy Hanukkah, Merry Christmas, and a meaningful and healthy new year for everybody as we face 2026. Thank you so much. Seeing no further business, we are adjourned.